And the Ministry of Health has exuded confidence that the ongoing talks to forestall the looming strike will bear fruit. Speaking a day after the talks between governors, the Ministry of Health and the Kenya Union of Clinical Officers in Nairobi, the Health Cabinet Secretary, Dr. Deborah Barasa, has urged for patience among health practitioners, vowing to address their demands.
Solidarity forever. With 4 days left for the government to address issues raised by clinical officers who have threatened to down their tools starting Sunday, 19th January, the Minister of Health insists there is no need for alarm among Kenyans. According to Health Cabinet Secretary Dr. Deborah Barasa, a consultative meeting called by Council of Governors on Tuesday in Nairobi has put the country in the right trajectory towards averting the clinician strike.
Accessibility is really critical, and one of the areas we're looking into is having the quality of care bill that will be able to be tabled, and ultimately will be able to have improved coverage and accessibility so that all the human resource for health will be able to offer services to Kenyans all over.
And on the issue of the professionals, this is an issue that has been raised. And even yesterday, as late as yesterday, there was a meeting between the Association of Clinicians, the Ministry, SHA, and other players with a view to find a solution to that issue. And I'm very confident that a solution will be found.
Addressing the media at her Afya House office in Nairobi on Wednesday, Ms. Barasa emphasized government's keenness to ensure all Kenyans afford comprehensive health care under the universal health coverage. On Tuesday, Kenya Union of Clinical Officers leadership vowed to lead its members to a national strike should the national and county governments fail to heed their call for recognition and employment of healthcare providers and practitioners under the Clinical Officers Council and the reinstatement of pre-authorization rights for clinical officers under the Social Health Authority, SHA.
On the issue of facilities, I think that one has largely been addressed, because facilities owned by clinicians, just like facilities owned by any other person, are empaneled, and there's a very elaborate procedure under KPMDC. KPMDC works in collaboration with the other regulators in empaneling facilities. Then they are brought to SHA for contracting.
Joseph Wahungu for Prime Edition.